and they're both in their 50s and both in the Fraser Health region. The second group of 2 people are both in their 60s, also in the Fraser Health region, and these are people who were on the Grand Princess cruise. So you may have heard about the cruise ship that is currently off the coast of California, where there's been concerns about COVID-19. Both of these people we were notified of a number of people who had been on the previous cruise. So the cruise on the Grand Princess from the 11th to the 21st of February. A number of those people were British Columbians, and we have been following up with them since we got that information earlier this week. 2 people that were identified as positive yesterday had symptoms in the recent days, and they're both in the Fraser Health region. And they were identified yesterday, and earlier today they've been admitted to hospital in Fraser Health for assessment and monitoring. They're both in stable condition, but it was felt they needed to have a more detailed health assessment given their age and the concern about this virus. And I think this reflects that there are a number of others across the province who we are been in contact with in the last few days, and there may indeed be more people who turn up positive who have been on that cruise. We also know that there's at least 2 people in Alberta as well, or sorry, 1 person in Alberta that was on that cruise who's tested positive for this, and others in Ontario that we're aware of. So that is concerning to us, and reflects some of the risk that we're seeing right now in cruises around the world. The last 2 cases really are the most concerning to us, and I'll go into some detail about those. So these are 2 people who are residents of a long-term care home on the North Shore, the Lynn Valley Care Home. The Lynn Valley Care Center, and they were identified as part of our investigation of our community case that we talked about earlier this week, we're calling Case 21. She is somebody who works at the Lynn Valley Care Center, and the team from Vancouver Coastal Health has been on site at the center in the last couple of days doing a detailed assessment of all of the staff, the residents, and the family. And that is part of our outbreak response. We now have 2 of the residents who have tested positive, so we are in what we call an outbreak at that care center in North Vancouver. This is one of the scenarios that we have been, of course, most concerned about. We know that the risk for elderly people having this disease is very concerning, and that they are more likely to have more severe disease, particularly older people with underlying chronic illnesses, and we know that that is the case with many people in our care homes. We also know that many people who work in care homes work in many other settings as well. So there is an ongoing, very detailed investigation that will be done by teams from Vancouver Coastal Health, and making sure that we can link where everybody works from that care home. If there's other facilities that we need to do more investigation on, we'll be going through all of the residents, and Vancouver Coastal Health is right now meeting with the families of the people who are in that care home and with the staff. So this will be an ongoing, detailed investigation. The care home is what we call in an outbreak protocol, so visitors are restricted. There is infection control precautions being taken by all of the staff for every interaction in the facility and all of the residents, and we will be curtailing the numbers of people who move in and out, and making sure that we are able to address this as swiftly and as thoroughly as we possibly can. And Vancouver Coastal is doing an excellent job, along with our teams of nurses and people in the home itself, to make sure that the families are supported and the residents and the staff are all supported and cared for during this investigation. Other than that, our other cases, as you know, there are 4 people who have recovered. Everybody else, we have the 2 people that I mentioned who are in hospital now. Our other person who's in ICU is stable and is doing okay at this point. and everybody else is in isolation at home. And we also have a number of people who are in isolation who have been contacts of these cases, and we're monitoring them closely as well. The message that I think is so important for British Columbians today is that you need to stay home when you're sick. If you've traveled, even if you haven't traveled, now is the time. We are in an extraordinary situation. We need everybody to be aware, to look after their children, to understand if you or your children are sick, stay home, isolate yourself, let your body recover. If you have concerns about exposures to COVID-19 or you develop more severe symptoms and need to have medical assessment and medical care, then please call ahead and we can get you that care. And not everybody who has an infection right now or has respiratory symptoms needs to be tested for COVID-19. There are many other things that are causing those symptoms. So do phone ahead. And if you do have risk factors for COVID-19, we will be able to help you get assessed, tested, and cared for if needed safely. I think that bears saying that there's been a number of community exposures, and coming up onto this weekend, we need to reconsider some of the events that we have around gatherings, particularly religious gatherings and other gatherings of groups where we come together. And at this time, I'm asking people to consider having virtual gatherings, to consider not coming together, particularly if you have people in your gathering who are elderly, who are more
Just take a moment. It's okay.
Who are more susceptible to having severe illness from this disease. And if you are going to get together, let's look at refraining from our usual greetings. Now's the time to put some distance between us to keep our germs to ourselves. So if it's shaking hands, whether it's hugging and kissing in those types of settings, please consider refraining from that at this point. I also want to talk a little bit about cruise ships. As I've mentioned, cruise ships right now are really high risk. There is no way to guarantee your safety at this point, and we would strongly recommend people forego that type of travel at this point. We know that the elderly in our communities are at high risk of having severe disease or complications from this COVID-19. We know that they are also at high risk from the other respiratory viruses that we see circulating right now. And I think I'm calling on all of us in BC to do what we need to do to protect our seniors and elders in our community and to keep them safe.
Thank you, Dr. Henry, and I just wanted to take the opportunity to reiterate some of what Dr. Henry said and some of what we talked about yesterday in our preparation and our plan to prepare for pandemic. The cases that we've seen today, the 3 sets of cases, reflect the fact that we are living in a highly interdependent world. A couple of weeks ago when we announced case 6, which was our first case from Iran, essentially that was a sentinel for the world about travel to Iran. Prior to that, this was largely viewed in the context of travel from China and of the situation in Hubei province in China. So that reflects change, and we're continuing to see that reflected in 2 of the cases. In the 2 cases involving people that came from the Diamond Princess, and you recall that there were 127 people on the cruise in question. We're talking about the cruise that ended on February 21st, not the one that we have seen in the last, that is off the shore of California now. That in those cases, in the case of the Diamond Princess, this is people who have returned to British Columbia. They're just at the end of what one normally think would be the period that we'd see it, but they are within that period, and they've been found to be positive. And we are actively, we have been actively looking at those 127 people. I know that the Chief Medical Officer of Canada essentially said yesterday, don't go on cruises. And I think that's an important thing for people to consider. Consider the people who spent time in Tokyo, consider the people currently on the Diamond Princess and those who are back from the cruise, that there are risks that cannot be fully calculated right now. And so I think people have to consider seriously Canadians. There are essentially no cruises yet. Our cruise season hasn't started in British Columbia, and the federal government and the cruise industry and ourselves and many others are in discussions, and we'll be in discussions about that. But those who are considering going on cruises, who have bought tickets on cruises, need to very seriously consider their position. And if you're asking my advice, I say don't go, just to be clear. With respect, of course, to the situation at the care home, yesterday we took you through, and Dr. Henry took you through in detail, the information we have about COVID-19 internationally. You'll remember that there were virtually no mortality rate amongst children. We saw at that time that there was very little, even in the epicenter of the outbreak in China, very little mortality under 50, in fact, but that elderly people were very vulnerable. People in hospital are very vulnerable. And obviously we take this very, very seriously. Anybody such as Dr. Henry, who has experience with this, who's had experience practically with this, knows this. And we saw this in particular in Toronto during SARS, that this is an area where our response is total in the healthcare system. I want to make a couple of points about it as well. We are obviously mobilizing in Vancouver Coastal Health in support of all care homes. We know, and anyone who knows the care home sector knows, that many care aides and others, in order to live in a family supporting way, work in multiple care homes. And so this will involve also mobilizing and in support of those care homes as we make our efforts to ensure that people are safe. I want to express my admiration for the people who work in the sector, the love they show for their work and their commitment to one another. And nurses and care aides and others in care homes in British Columbia, we're very proud of them, the work they do. And this shows, if it needed to be shown, the importance of the work they do. And so this requires, and it's why we require, a whole of government response. This is these briefings, which will almost certainly be starting Monday, daily briefings. These briefings are intended to tell the public about these circumstances. And these are challenging circumstances. And we have repeatedly said that. We live in an interdependent world. What happens in public health in Tehran matters in British Columbia. What happens on cruise ships far from our shores matters in British Columbia. What matters in China matters in British Columbia and Korea and in our communities and in Seattle. So what we're also asking people to do, and certainly it'll be the case that when I go to church tomorrow and others, is if we are having church services, for example, or community services, for example, one of the great things that most churches do is do a lot of hugging and handshaking. And we're asking people, if they're going to church, not to do those things, to engage in social distancing, especially and finally in respect and support of older British Columbians, because the implications of the virus for older British Columbians, should they become infected, are significantly more serious. And so what does that mean? That means, of course, and we've repeated it, but it bears repeating again and 100 more times. We need to wash our hands regularly. We need to not touch our face. We need to throw away Kleenexes. Right? We need to not go to work if we're sick. We need to not go to school if we're sick. We need to not go to large gatherings if we're sick. We need to not visit our loved ones in hospitals or in care homes if we're sick. We need to not go and see grandma and grandpa if we're sick. These are important considerations that people have. Public health is fully mobilized. I am so proud of Dr. Henry and the team and what they've done in BC. And we are so fortunate in British Columbia to have such outstanding people whose commitment to helping people in these very circumstances has been across Canada and around the world, leading our efforts to address this question. I have to say, for everybody in public health, I say a big thank you. And for people in the community as well, because I know people are conscious of this. This is our time to pull together and to do what we can for one another. And what we can for one another is usually to embrace one another. even physically. But in this case, we can support one another in our lives, but in this case, we have to be very conscious of the effect of our actions on other people and to ensure that other people are safe and that other people are protected. So with that, we're happy to open the floor to questions.
Can I get from Montreal just a brief recap?
On a eu 6 cas de nouveau en Colombie-Britannique, 2 cas qui sont liés au voyage du terrain en Iran. Nous avons 2 cas qui sont liés au bateau croisière Diamond Princess. Il y a 127 personnes qui sont revenues en Colombie-Britannique le 21 février de ce voyage croisière, et 2 personnes ont été trouvées positives hier soir. Troisièmement, il y a 2 personnes qui habitent actuellement au Lynn Valley Care Home qui ont été testées positives aujourd'hui, hier et hier soir, et on travaille fort. On a des rencontres avec des familles qui se déroulent actuellement par Vancouver Coastal Health. On fait tout un travail là-dessus. Nous sommes bien entendus. Très concernés de ce qui se passe là-bas. Tout le système de santé est mobilisé pour ce centre de soins, et des centres de soins un peu partout dans la région de Vancouver, parce qu'il y a beaucoup de monde qui travaille dans plus qu'un centre de soins en Colombie-Britannique, et donc il va falloir mobiliser nos travailleurs dans le secteur pour aider des gens, surtout des gens de troisième âge. Finalement, je veux dire très clairement aux gens en Colombie-Britannique ce que le médecin national qui mène nos efforts nationaux, Dr. Tam, a dit hier, il faut considérer sérieusement si on veut aller en voyage croisière dans le monde à cette époque. Si vous voulez savoir mon avis, ne va pas maintenant, parce que ce n'est pas possible de considérer ou d'estimer des risques pour des gens. Donc, c'est ce qu'on a reporté aujourd'hui, et on va après, we are ready to take questions.
Okay, we're just going to get started with questions. We're going to start first with questions in the room. If you could wait for my colleague with the microphone to bring you the microphone, and please identify yourself using your name and outlet. And then we're going to go to the phones. Just a reminder for those on the phones to please press *1 to queue up. Go ahead.
Hi, it's Penny Daffels from CTV. I don't know if Dr. Henry or Minister, you want to address this, but in recent days in particular, there has been a fatigue from people. I feel like there's been a lot of, the media is blowing this out of proportion. I'm tired of hearing about this, and people are, quite frankly, starting to tune out of some of these updates because they think it doesn't affect them and they think that this is overblown. If you could please just explain to people why it is that you are updating us and just how serious the situation is, that I think that would be very helpful.
Well, I'll speak first, and Dr. Henry can speak in a moment, but one of the reasons we have been so regular in our reports is that I expect we're going to be dealing with this in the weeks, indeed months to come. This is relevant to everyone's health in British Columbia. I think at the beginning, when we were dealing with this, often people who didn't have connections or didn't know anyone who was traveling to Wuhan or Hubei or to China thought it was a problem over there of somebody else. But it's a whole community problem, and you see it in these 3 sets of cases today. We take unbelievably serious. There's a comprehensive mobilization of public health around in support of the families and the residents and the staff of the Lynn Valley Care Home. But this is significant. If anyone thinks that it is the right thing to do if you're sick, to visit family members who are seniors, to visit care homes, to visit hospitals, let's disabuse people of that. And one of the reasons we're doing this consistently is there are people who are fatigued, perhaps, who've been following this from the beginning and tired of these reports, and there are people who are just bringing this to attention. So when we repeat that people should wash their hands and not touch their face and stay home when they're sick, there may be people who haven't heard that message, and so we have to continue to deliver it. I personally think the media has done an excellent job in covering this. We need to focus on the science. The science builds the confidence we need to have. But we're going to continue to do this and over the next period, because I think it's very important that the public is informed. Yesterday there was a question about rumors and about rumors of cures and so on, right? And this is why there has to be sources of information that are accurate and reflect where we are. The reason every day we come and announce cases is so that no one can speculate on cases. No one can say, oh, we heard there were X number of cases in X communities, because we are announcing them every day, right? So that when we say there's no cure for COVID-19, there's no vaccine for COVID-19, you see on the internet people claim this, and I have one piece of advice for that. If you see someone on the internet claiming that, unfollow them. And if it's not your mother, block them. Because it's, you know, it's very important that we distribute accurate information, right? So accurate information about health consequences, to understand what they are, because for many people, even those that get COVID-19, and we've seen this, most of the people who've had it in British Columbia are at home, and so they're by definition stable. They're not in acute care. We have 3 cases in acute care now, and 2, of course, at the Lynn Valley Care Center in North Vancouver. But you know, the critical part is to continue to provide information. This is relevant to people. We have now people in the Interior Health Authority, in the Fraser Health Authority, in the Vancouver Coastal Health Authority. So there's been more focus in those areas about these issues. We haven't had any cases in Northern Health or Island Health, but that may well change. And so we're going to continue to inform. We're going to continue potentially to bore people from time to time. But I don't think today's very significant events are that way. And it's the reason why there is this comprehensive government approach to this, because you look at nations around the world, powerful, strong health systems like Japan, like Korea, like Italy, where they've had significant outbreaks. I think it's fair to say strong health systems like ourselves. So this is a significant issue, and so what we've tried to do in these things is to both calm fears, but also state what the facts are so that people are prepared and understand and doing the things they need to do to support one another. And I'll say it one more time: if you're sick, stay home.
Dr. Henry?
I just want to say that yes, I think all of us are a little fatigued, but we are by no means near the end of this, and we have seen the progression around the world. We've seen what's happened in other communities, and we are preparing as best we can for that. We know now that we've had community spread. We know that it's affected a long-term care home. We know that it is affecting our communities now here, and we need to start being aware and taking those actions on a collective basis in our communities here, particularly so that we can protect our health care system and so that we can protect those who are most vulnerable in our communities, our seniors and our elders.
Dr. Doug from the CDC, within the care home in North Vancouver, is it in one unit within the facility, or is it spread without? I know they have different units in many care homes.
So the investigation that's part of what they'll be looking at. The people who work in that care home work in many different areas. So it's the entire facility right now is under outbreak protocols, and all of the residents and staff will be, and the families will be supported and investigated.
Jill Bennett with the Global. Can you talk a bit more so the care rate at that facility is the community case. So are you confident, or will you be able to, you think, to find out where that person became infected? And do you have any idea then how many people might be exposed between the residents, people visiting, and people who work there?
Yeah, so it's a couple of things. It's a healthcare worker. I didn't say it was a care aide.
Oh,
So it is one of the healthcare workers in that facility, and as we were investigating, we determined that other people in that facility, including some residents, were ill. It's unclear whether they became ill from that healthcare worker, or whether they were all exposed to somebody else. So that's what the investigation, the outbreak investigation, is looking at. So the timings of when people started to become ill, looking at other residents, making sure everybody else doesn't have symptoms. As we know, sometimes the symptoms can be quite subtle early on. So it is going back then 14 days from when her symptoms started and trying to determine where her contacts were. So it's unclear at this point whether her contact was something in the facility or whether she was the person who brought it into the facility. So that's part of what the investigation will see, from her contact somewhere else.
Do we have the number of how many residents living in this care center, and how old are they? Are they all seniors?
Yeah, I don't actually have that number. It's we can find that for you. But as with most care facilities, the population is people who are elderly. Yes.
I believe the number is just is over 200.
Is there a point at which BC would then perhaps follow Washington State's lead? Does something have to happen to declare a state of emergency or to declare it kind of next level?
Do you want to do that? I think the issue is, and Dr. Henry talked about it, is the reason they have to declare a state of emergency in Washington State is technical. We have many of those powers already, and we're exercising those powers under the Public Health Act. And so should the additional powers under the Emergency Powers Act be required, then we'll do that. But effectively, this is our response. It's a full-on government response and community response to this. So these are technical questions, but we're using the extraordinary powers of the Public Health Act and other powers of government right now. And so the declaration of the emergency isn't important, and I think if you can see the sort of comprehensive response we're making, this is a full-on effort.
Okay,
And so we have all
Sorry.
the powers that we need under the Public Health Act to do a detailed investigation like this, and but it's another piece of tools in our toolkit, as we talked about yesterday. If we need them, we can do them, and sometimes a declaration of an emergency can heighten people's awareness of what's going on, and sometimes we do that for that reason. I don't think we're there yet. I think we're seeing lots of different challenges that we're facing with this virus, and we're hoping that the messages that we'll get out about the important things we all need to do right now will help us.
And regarding to the case from Hong Kong, we announced the flight. Have we found any passengers at the same flight, and have we tested? How many people have we tested, and are they being isolated now?
So the person from Hong Kong, the flight, she was in India and Hong Kong. It was a flight from India to Hong Kong. So we are not following up on those people. There is no other people that we're aware of in Canada or in BC from that flight. But we have passed the information to the airline and to the authorities in both Hong Kong and India.
So can I have one question? You mentioned gatherings. Like the big rugby gathering is taking place this weekend. If you're just telling people maybe go to virtual church, should we still be having these large gatherings?
Yeah, so this is a risk assessment, and it's a risk assessment looking at the populations that are coming, where they've been before, who comes there, what's the ability to maintain some distance, to clean your hands, to monitor people. So it's clearly a different sort of scenario when you're talking about the rugby sevens and young people, and then what's at risk most right now is those close contact gatherings. So places where we're spending a lot of time with our family, with friends, where we are within 1 or 2 meters of each other, where we can share our droplets and pass them on to others. So for people who are going to things like the rugby sevens, it's really, really important, if you are sick at all, to stay away. But to also, there's more distance there, there's more, you can clean your hands regularly, you can not touch your face, all of those important things that we need to do to keep healthy in our environment. But rule number 1 is don't go if you're not feeling well yourself.
Doctor, I just had a question from somebody there. You got really emotional.
I did.
Is there a personal side for you? I had parents in care. I don't know, they're not with us anymore, but what's your personal... I've never seen emotion come out of you before so far, and it's very human. And
I'm not sure if it's you've not seen emotion. Maybe I'm just good at hiding it. No, I think this is something that I'm very concerned about. I went through SARS. I've been through Ebola. I've been through the pandemic in 2009. And I just know how stressful it is for our healthcare system, for my colleagues, and for families that are dealing with this. And I'm probably a little tired myself, but
Yeah.
what can I say? It's a very difficult time, and I'm feeling for the families and the people that are dealing with this right now.
Yeah, and just to say, I think it's one of the extraordinary strengths of Dr. Henry and her experience is, and our whole team, because this is an experience that people are having right now. Our outstanding team in Vancouver, Coastal Health, led by Dr. Patricia Daly, who many of you know, and all of the people working in healthcare. This is very personal to them, and one of the things that Dr. Henry has brought to the table for us and for me, having gone through these experiences in the past, having met with people who've been affected by SARS and by Ebola, having treated those people, having lived through that, I think those are real experiences, and I believe strongly it's a source of strength. So obviously we come here to present the facts and so on, but we're really engaged in this, in every part of us. This is not an exercise, and the fact that Dr. Henry has these experiences has been so valuable to everyone in the system, because they can have confidence that she doesn't just have brilliant knowledge and outstanding communication skills that we've seen, but also every case, every single case, she profoundly cares about.
Well, I have you. Just one more question for the minister. Is the cruise industry, I know this personally, got an email yesterday saying we can transfer our cruise, cancel it, no penalties to another cruise for even a month. And at the same time, they offered incentives to stay on board, cash credits. They're sort of telling you on one hand, you can get out, but on the other, if you want to stay, we'll give you more. How do you feel about that type of approach?
I think the Government of Canada, which has the primary responsibility because it's offshore, Transport Canada, the Government of Canada, defer to them in the work they're doing with the cruise industry. But I think people expect us to tell us what we think. And what we think is that you have to be prudent in these times, right? That we cannot, there are no guarantees. We have in the hundreds of Canadians aboard the Diamond Princess right now off California. We have 127 British Columbians who've returned here to British Columbia, 2 of whom have tested positive. But obviously it's stressful. They've been asked to be in self-isolation, and a number of them who have respiratory conditions that may have nothing to do with COVID-19 are going through that process, and we're working with them right now. So these are the practical realities, right, of people these things are actually happening. And we saw it in Tokyo, we're seeing it off the coast of California, and now we see it in British Columbia. And this has consequences, and people should know. And this is important for the cruise industry and everything else. So I think obviously the cruise industry is concerned about the people who go on their ships, and the federal government and Dr. Henry and others are working on how we address that question in the coming year, which is not immediate in British Columbia, but it's coming soon. But with respect to people going on cruises, if you've got one, and this is the same as the rugby sevens, if you're sick, you know. I played rugby. I love rugby. I don't have tickets this week, but I know people love that event and have been waiting for that event to come to Vancouver. But if you're sick, don't go. Watch it on TV.
Okay, we're going to go to the phones now. First up, we have Andrea Wu from the Globe and Mail.
Hi, I just wanted to ask what the outbreak protocol at the Lynn Valley Care Center looks like. And I'm not sure if I missed this, but do we know how many British Columbians we're looking for on the Grand Princess right now?
The ones that are on the cruise right now, no, there's 230 some Canadians. We don't know the breakdown of where they've come from. The previous Grand Princess cruise, we had a little over 120, I think it was 127, 129, who were from British Columbia. And so the outbreak protocol, this is something that is very familiar to care homes in British Columbia. We have a respiratory outbreak protocol that we've had in place for many years that helps protect residents in long-term care particularly around influenza. So it is exactly the same things that we do for influenza, and it is restrictions of visitors, making sure that residents don't congregate, that ill residents the residents are all monitored daily for respiratory illness, that they're stay away from others, they're isolated if they do develop respiratory illness, making sure that PPE, personal protective equipment, is used for all interactions, so wearing masks and eye protection and gloves and gowns if needed, and hand hygiene within the facility, stopping communal gatherings. There's processes for residents being separated during meals, and it's hard. It's hard on families, it's hard on the residents. Often older people may have dementia, other things that make it challenging to be in that situation, and it's hard on the staff as well. We know some of the staff are ill or off, and it puts an extra burden on all of the staff. It also means that we restrict visitors that go in. So every visitor is screened. They can only go to visit their one family member, and they go immediately in and out, so that we don't have a lot of mingling in the common areas, mingling with other staff or with other residents. And that is very hard too. And residents, family members who go in, we limit the numbers, and they go in one at a time. They also need to be protected and wearing masks, and so that they're not passing something on to residents as well. So it's a challenging time for everybody, but it's really important that we do that now, that we break any transmission within that facility, and that we get a handle on where the transmission is elsewhere in our healthcare system as well.
Thank you.
Next up on the phones, we have Bob Mackin, the breaker.
Hi, good morning. With the Lynn Valley Care Center, it's in an area with potential for public interaction with staff and residents. There's a bus stop in front, there's a fire hall across the street, there's a school around the corner. It's a very short walk to a community center, a church, shopping mall. There's also another seniors facility just down the road. How has that added to the challenge, and what do you say to the people in that Lynn Valley neighborhood who frequent those locations, where also residents and staff from that care center also frequent as well?
Yeah, so right now, we know that this virus is transmitted through close contact. So it's not transmitted in the air, it's not transmitted outside, it's when you're close to somebody. So providing care for somebody, sitting next to them, talking, being with your family member. So it's not a public risk in that way. So I think they need to not have concerns. Any residents who are out in those situations in those other places were not ill. We're certainly doing the investigation to try and determine any of those close contact situations anybody who is ill might have had. But there's no general concern for people who are in the community themselves.
A resident from the care center, as well as someone who's using the community center swimming pool, for instance. There are definitely opportunities there for close contact in that area beyond just sitting next to someone.
Absolutely, but you have to be sick, and you have to be in close contact with someone while you're sick. So, those are the things that the investigation will determine for every one of the residents and the staff in that facility and the families.
Okay, I think that's it. Thank you very much, everybody.
Thank you.
I'm hopeful that you won't play the emotional part of me too much, because my parents will be really upset. My mother already tells me I look tired. So.